Good evening, folks. Welcome to our Onward Transitions Family Forum for May. I'm Andy Derstine. I'm clinical director and one of the therapists here. And I'm joined by Jackie Roberge, who is running the show behind the screen here, who is my fellow clinician. So thank you, Jackie. So tonight we're going to talk about entitlement, accommodation, grit, and resiliency, and see if I can tie all of these things together. So one of the things that we see, this isn't across the boards, but for a majority of the members that we work with, one of their challenges is grit and resiliency and the ability to manage distress tolerance. And whether that's anxiety, whether that's, a long day at work, functional things, emotionally based things, it tends to be a challenge with them. And so we try and understand where that's coming from and then what we can do, we meaning parents and us collectively, to help them have optimal experiences, to develop more of that resiliency to help them get through day-to-day life. So we're going to talk about some of these different factors, things, how we create grit, resiliency, some of the things that might get in the way, both in terms of the individual personality, but also, some of their limiting factors that influence how we parent them. And so this is sort of a nature-nurture interplay in terms of how we develop this and some of the things that can get in the way. And then we'll talk a little bit about what we do to try and help with this. So let's get a couple of definitions out of the way. So I'll start with entitlement, okay, which is on the face of it, a pretty pejorative term. And so the Oxford Dictionary defines entitlement as believing oneself to be inherently deserving of privileges or special treatment. Now, the term entitlement has become somewhat synonymous with terms like pompous and arrogant and selfish and rude, or spoiled and whiny. And we hear this a lot, in day-to-day conversation. The American Psychiatric Association defines it as an expectation of special favors without assuming reciprocal responsibilities. Now, that working definition from the APA is most closely associated with narcissistic personality disorder, because a strong sense of entitlement and lack of empathy are one of the key symptoms of narcissistic personality. So entitlement is not a behavior particularly, nor is it a diagnosis. Within the person, if entitlement, a sense of entitlement exists, it's kind of a belief or an attitude. But just as often, if not more often, it's a judgment being made by other people about the individual. He's so entitled, or she's so and has such an entitled attitude. And so it's kind of limited in its usefulness, honestly. And so part of our training here, our in-service work, our work together is to really take stock of these kinds of things from time to time. Are we slipping into, some attitudes or judgments about members, like, he doesn't want to go to work? Is that entitlement, or is it something else? So, we have to kind of take our own gut checks around this from time to time. And what we generally come to is that what we're looking at is really not entitlement in that sort of pure form, but more this lack of resiliency, coupled with, first of all, their own unique temperament. And that temperament might be influenced by mood disorder, by ADHD, by neuroatypicality, and I'll get into some of this. And then that the interplay between some of those conditions and um, and having to parent those challenges, and some of the accommodation um, that that is a result of just trying to get my kid through the day, basically. Um, and so, with respect to, let me start with how do we develop this grit and resilience? Um, so first of all, it has to do with our individual temperaments. Some people are just born with sort of that resiliency in greater supplies than others, and other people to lesser degrees. Um, but in terms of child development, um, it's important that children going through childhood experience optimal or therapeutic levels of frustration tolerance. And it's sort of like getting inoculated. You get small doses of this, you learn how to manage it, which then allows you to incrementally experience more challenging or frustrating situations. And so this has a cumulative effect across not just childhood, but adulthood as well. At first, that distress tolerance is more biologically based. So an infant crying because he's hungry. Um, we want to be responsive. We want to be nurturing. Sometimes it takes a few minutes to stop what you're doing and feed the baby. Um, that becomes an exercise in frustration tolerance in a small way. Now, they can't learn from it or grow from it if it's too overwhelming, if it's too big. So a baby that cries for an hour without getting fed is not experiencing optimal levels of frustration tolerance. They're overwhelmed by it. And it's more traumatic than growth inducing. The same with comforting a baby. As an infant, they can't self-soothe. They're still dependent on their parent. That self-soothing comes down the road as they develop some of these skills. But, to leave a baby crying for hours in distress is not helping them develop frustration tolerance. That overwhelms them. Predictability, trusting that mom is going to come pick me up, all that sort of basic trust that sets in is part of developing frustration tolerance. As child gets older, being able to stick with a task, whether that's, building blocks and rebuilding them after they fall down for the fifth time. Just small tasks of life. These aren't necessarily big experiences, but there's a real cumulative effect of these things building. And so, in an ideal world, that's what we hope to see. And none of us get it right as parents. There's plenty of room for us to goof this up without goofing up our kids. They're pretty forgiving in that regard. But so if your child has some challenges with ADHD, with anxiety, with sensory integration, whatever, these things are not going to fall into place as easily because they're temperamentally or just organically going to get overwhelmed much more quickly. And so those things that the parenting books tell you to do aren't going to work so well. And this is where it can get tricky for parents because there's plenty of people out there wanting to judge you and tell you how you're doing it or how you're doing it wrong. And I've been working with families from kids, infants up through adolescents and adults for years. So I've talked with lots of families and lots of the judgments that they hear from others. Whether it's relatives, in-laws, friends, women in the checkout line, men in the checkout line. It's things like you give in to his tantrums too much. Your kid's never heard no in his life. You just need to let him cry. He's never had to work for anything. The kid is spoiled rotten. He just needs a good spanking. So, as parents, you start to get a lot of these judgments. And And that can be hard because generally people, generally speaking, people just don't understand what you're going through. So let's say you have, the other thing I want to say about that is Jackie and I work with all of you as parents and as families. And as we get to know you, we know your values. We know what you're trying to instill with your kids. We know that you are not raising entitled children. So I want to be clear about that. That's not what's going on. When we have to do a gut check around, is this kid acting entitled? We kind of circle back around to, okay, that's not how this kid was raised. This is not affluenza. And so just to be clear about that, but that doesn't mean that people aren't going to make some of those judgments about you. So, let's look at the interplay with some of these different situations. So, if your child from an early age is experiencing anxiety, and chances are pretty good it's not going to get diagnosed for a little while. So you're not going to be real clear what's going on. They're going to be more inflexible, more rigid around their routines, less likely to handle changes in routine, less likely to handle changes, in parenting styles or even who's parenting them. And it's not because you're doing anything wrong. It's their nature. And so they're already kind of, if their level of anxiety or excitability or whatever, if we're talking a scale of 1 to 10, they're already at a 7 just because of that innate way of being. And so, an example of the interplay between that and parenting. So let's say your young child has separation anxiety disorder, which is a common precursor for generalized anxiety disorder. And that separation anxiety plays out as I'm not going to school. And school refusal is often confused with separation anxiety or school phobia. And so, a normal situation where a kid doesn't want to go to school, the parents might be somewhat sympathetic and also take a bit of a tough love approach. All right. Today, I'll go down to the school bus with you at the bus stop and I'll wait for the bus to come. But, after that, you're on your own because you can do this. Now, you try and do that with a child with separation anxiety and they're going to have a complete meltdown, right there at the bus stop. And he's not going to get on the bus and he's not going to make it to school. And, if you've had this situation, you know how it plays out. And so you then have to figure out how to get him to school. And so this is where the accommodation can start to take hold. So, instead of doing tough love at the bus stop, you're now driving your child to school. And again, it's not because you're treating him or her as a precious child who shouldn't have to ride the bus or they're too good for that or any of that stuff that might be associated with entitlement. It's because it's the only way you're going to get them to school. And it has the unintended consequence of getting in the way of them developing resiliency because they're not having to sit with the discomfort. Now, they still have to sit with the discomfort of going to school, even though they don't want to, but the dynamic has changed. So, that's just a simple example of anxiety. And I'm sure as parents, you have many more. This can come to play with doing homework and doing schoolwork. Kids with anxiety tend to be very perfectionistic and they get really hung up on if I don't do this right, I'm not turning in my homework. And so the stress level just goes way high around the dinner table, on a Tuesday night as you're trying to do the homework. And so what ends up happening? Parents end up sitting with them, helping them get through the homework, sometimes doing the homework for them just to get it done. And so instead of them having that developmental experience of, this is a little frustrating, but I can hang in there and get this work done on my own, it becomes an exercise in, all right, what do we got to do to quiet down the anxiety so that we can all go to bed around here tonight? And again, it's an accommodation out of necessity. And I think these sorts of little vignettes happen over and over again in the course of a family, and it starts to impact frustration tolerance, distress tolerance, all those kinds of things. So let's say you've got a child with ADHD, and they're 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 challenged with executive function stuff. They're challenged with impulsivity. You think of the mom in the checkout line at the grocery store with their ADD kid who's throwing a fit because they want that toy that's in the checkout counter that they shouldn't put there, but they do anyway. And so you're doing your best just to get out of the store, pay for your groceries and get out of there. But you feel like, my God, I'm a failure as a parent, or people are judging. You shouldn't let your kid throw tantrums like that, or why did you buy him that toy? You're just reinforcing that behavior. And a lot of times it's just about getting through whatever's going on in the moment. But again, it can have the unintended effect of accommodating them. So the other thing with kids with ADHD, they're not good at sequential tasks. So you ask your child to go put on your pajamas, wash your face, and brush your teeth. And by about the second thing in the list, they've forgotten what the third thing was, and they're off, making bubbles. And so as parents, you have to get over involved, and you have to be reminding them, and walking with them through the tasks, or we're setting up behavior charts and helping them. But again, we're getting over involved out of necessity to help them get through these tasks. And that can have an impact on their frustration tolerance, their ability to stick with things, to see things through to the end. Sensory integration disorder. This really can have an impact on frustration tolerance and distress tolerance early on. Their bodies are already vibrating and, at a 7 or an 8, just because of sensory overload from the environment, whether it's noises, whether it's, the feeling of the chair that I'm sitting in, or, the texture of the Annie's macaroni that I just ate because it wasn't the one that I'm used to eating. So again, you end up having to make accommodations just to help them get through life. And so you do sort of act like a short order cook, and you make separate meals for the child because they can't eat the meal that you're putting out for the rest of the family because of the sensory sensitivities. Or, they will only wear sweatpants to school, and they get rigid, they get stuck. This is the only way that I feel as though I can get through the day. But what then happens is that impacts distress tolerance. It impacts their willingness to explore the world. Okay, I'll try new food. All right, you bought me these new pants. I'll try them and see how it goes. That generally doesn't happen. And so it again limits their world, limits their resiliency. And with good occupational therapy, you can work through some of these things, but it becomes another one of those issues that the family starts to organize itself around. And people make judgments about, you shouldn't let the child leave the table until they've cleaned their plate. Well, that is just not going to work for a child with tactile sensitivity and food sensitivities. You need to make him change his pants and wear something different to school. Again, thanks for the advice, but it's really not going to work for him. So it's a challenge as a parent, because you're always a little bit on the defensive about these things. And at the same time, you know what's best for your kid. So one of the other unintended consequences of all of this is it can also tend to reinforce a child's sense of egocentricity, that the world revolves around them. And, when a child is young, they're supposed to feel like the universe revolves around them. That's where they get their healthy sense of self and identity. And as they get older and move from, immediate gratification, I want what I want when I want it, to secondary gratification, delayed gratification. As they move through that, they start to learn that the world is not revolving around me, that I have a place, and that helps them get perspective on others as well. But this can really reinforce and extend that sense of the world revolves around me, not because they want the world to revolve around them, but it's what the world has had to, how the world's had to organize itself to help this child be functional. And that's a hard thing for them to shake. The other thing that we see in members, this has to do with the neuroatypicality. We'll frequently have members whose verbal IQ is very high, and then their performance IQ is lower, and so the implications there are they're really strong verbally, and they want to discuss things, they want to talk things through, and because of the low performance or perceptual IQ, they have a much harder time with taking perspective, seeing the forest for the trees, seeing another person's point of view. So they'll be the ones that will just want to debate endlessly with you. I don't see why I shouldn't be able to play my Xbox until 2 a.m. because I don't have school and, whatever. And they will just go on and on and on. And as parents, it gets really frustrating because you would like to be able to say, I'm saying no because I'm your parent and I'm telling you. And they have a hard time with taking that perspective, so they will keep challenging you. And that can feed into this too, because they have a harder time with accepting the frustration of hearing no, and just accepting that, all right, this is the way the world works. But anyway, we will sometimes have this experience that, these folks seem to feel as though the world revolves around them, or I don't see why I should have to do this, which can sound and feel a bit entitled, but it's really not. They're learning how to manage this stuff and live in a world where they have to experience some distress and where the world doesn't revolve around them. So, here are some of the things that we do to try and help with this. And that's a collective we, because we try and collaborate with parents to help create optimal environments for them to continue to have opportunities to develop this stress tolerance. And I guess in some ways, the first thing that we do is utilize acceptance and commitment therapy. Because ACT in and of itself is essentially an exercise in developing frustration tolerance or distress tolerance. What are the difficult thoughts and feelings that are getting in the way? That's the distress. And okay, the goal isn't for all of us to make that go away or do it for you. The goal is for you to accept that there's going to be distress as you move toward with this committed action, whether that's applying for a job or, cleaning your apartment or whatever the task is. So that's one of the things that we do. I think creating clear expectations. So if you're coming to group, we expect you to be on time. If you're more than 5 minutes late, we're going to ask you to not come into group today. And, it's not because we're trying to be real hardball about it, but we don't want everything open to debate, because that is not helping them develop frustration tolerance. And it's also not helping them with developing their executive function skills. But that clear expectations and consistency, and then follow through on our part. So, we're trying to help them experience these therapeutic levels of frustration. We don't want to overwhelm them in the same way that we don't want to overwhelm, a small child by letting them cry for hours before we comfort them. We don't want to create a situation that is so overwhelming for them. Like, if you don't pay your rent, you're going to get evicted. They're not there yet. They don't have that skill set in place. So creating that expectation does not help them develop frustration tolerance. It might create some fear and panic, and it might also just shut them down. So we have to be really thoughtful about what we create for situations like this. So, which is why we talk about, let's look at what percentage of paying rent makes sense, because that in and itself is going to create distress for them. And in some ways, as most of us are more neurotypical, we can sometimes be dismissive. What's the big deal? You're making plenty of money. All you got to do is pay 40% of your rent or whatever it is. But for them, they experience it very differently because they're filtering it through all this anxiety and all these years of getting overwhelmed pretty easily. So it's important that we keep perspective ourselves on this, that these are important developmental experiences, and we may fall into making judgments about whether they should be able to do more than one thing at a time or one thing a day. But they're working pretty hard to manage this stuff, and it's important that we keep perspective on that. Other things that we do, we have an expectation. Now that we're able to meet face to face with members again, the expectation is that you come in for your appointment on time, and if you call and say, "Can we just do a virtual session today?" we're going to say no, because that would be accommodation, and you can manage this. And generally speaking, they can manage, and they say, "Okay, I'll get an Uber," and they might be a little late, but they work it through and they get here. So we really try and be mindful of, are we creating situations where we're accommodating, or are we allowing them to feel some of that distress so that they're building frustration tolerance and resiliency? Most days, I think we get it pretty much right. Other days, we miss the boat sometimes. But we constantly evaluate, we constantly assess, so that we're having conversations about this, so that we're not missing something, or there aren't unintended consequences of a decision I'm making about whether or not a person has to have an apartment consult, for example. So we work with all of this. Having expectations of apartment consults, that they keep their apartments clean. We're not going in and doing it for them. With COVID, we can't go in at all. But the goal and expectation is that you're going to take care of this. We're here to help monitor. We're here to help support, but we're not going to do it for you. That reminds me of another sort of classic ADHD thing with kids is, them trying to keep their rooms clean. And, they usually get completely overwhelmed, and parents have to spend some time getting them on track, cleaning their rooms again. So, because they get overwhelmed, it becomes a bit of an accommodation. So we really try and be thoughtful about these things so that we're not inadvertently playing into it. So, this might play out in working with Katie on finances. My first paycheck should go towards paying a portion of my rent, not going out and buying a new stereo system for my apartment. Sort of the delayed gratification and the frustration tolerance of having to wait to get the thing I want, because first I need to take care of the thing I need to do. And they're all a work in progress, and they have good days, they have bad days, and we all keep hanging in there with them. It's one of the reasons we have conversations with parents about, all right, what's a reasonable amount of rent for them to be paying? Because we don't want to feed into that egocentricity of, I just earned a paycheck, I should be able to spend it any way I want. Well, no, perspective, your parents are paying 100% of your bills right now. And it's important for you to pay a portion of that. But we don't want to overwhelm them with so much that they can't manage it. So that's kind of the theme of this. So I think I have covered pretty much what I wanted to go through tonight. And if you have any questions, thoughts, comments, vignettes that would be helpful, please email them into us. We'd love to see them. And I thank you for taking the time to be here tonight. And we will see you in June. We'll send out a message letting you know when the next forum will be and what the topic will be. So again, thank you. And Jackie, thank you for helping make this happen. Good night, everybody.